One of the other things we often see in practice, is probably one of the more common things I see, is shoulder pain. And we've talked several times about how to differentiate the different types of shoulder pain. Probably about 90% of people that come into the office with shoulder pain have about the same story, and it relates to impingement syndrome. And that's tendonitis of the rotator cuff, bursitis, all these things fall into the same syndrome. We have a picture here of the rotator cuff, and what happens is as we come over here and it shows up on the telestrator, hopefully, the bony roof over the shoulder pinches the rotator cuff as the arm is elevated, and the biceps tendon you can see in the shoulder coming up will also be pinched in that area. This causes the cushion between that bony roof and the rotator cuff to be inflamed and swell, and so that as you bring your arm up, it tends to pinch. And typically the story that I hear is that it causes pain at shoulder level or above. In this area here, you get a sharp burning pain. The pain is almost always on the lateral outer aspect of the shoulder. And a lot of people ask me and say, well, it hurts down here. Why are you talking about up here? And you see here, here's the bony roof, and right through here there's a little jelly-like area that we call the bursa, which is just like jelly ball bearings that allow the rotator cuff to slide under that bony roof. The actual shoulder joint itself is down here. And this is the pinch point. This is where it impinges, and that's where the name comes from. So the story is usually pain up at 90 degrees or higher, and typically it hurts worse at night. People often say that the pain is just unbearable at night, and if you ever had it, you know what I'm talking about. And I've had it too, and it gets your attention. And when it gets to that degree, that's when we start talking about treatment options. Now, the impingement can be just an inflammation of the bursa. It can spread and be part of the tendon just below the bursa, which gives us a tendonitis. Tendon and the itis is just inflammation of, so tendonitis is inflammation of the tendon. And with time, it can actually wear a hole in the rotator cuff, and that's where you can see rotator cuff tears due to wear and tear. This is typically the area where the rotator cuffs are seen, right in here. On the, just lateral to the biceps tendon, we'll make a little circle here for you and see if our telestrator is going to work. Well, that's what you get with new gimmicks. So we won't use that today. But anyway, so the rotator cuff tears can be a problem with catching and mechanical symptoms, but usually the pain is still due to the pinching. Oh, there we go. We got a little circle right here. Here we go. This is the area where you get the rotator cuffs from pinching up underneath here. And it's often just lateral to this biceps tendon right through here. And this is where you get the symptoms. Rotator cuff tears that are these attritional type of tears, we just try and address the impingement or bursitis type pain that's out here. A lot of times if you correct the bursitis problem, you can leave the rotator cuff tear alone, especially in older folk, and they do fine. But when you have a younger population where you're doing a specific activity and all of a sudden you get a sharp pain, those are the rotator cuff tears that we tend to want to get involved with earlier and repair so that we get the best advantage out of the shoulder. We have a second opinion tape from the Mayo that will perhaps give us a little bit reinforcement on the rotator cuff injuries and how to make the diagnosis. So let's see what they have to say.
Rotator cuff injuries require an accurate diagnosis because there's a broad spectrum of abnormalities. Mild tendonitis all the way to a large tendon tear, which makes it difficult to raise the arm. So the first step would be to make sure that a diagnosis is made, and then often embark on a treatment program which involves modifying activities, controlling the inflammation with ice and maybe anti-inflammatory medicine, stretching the rotator cuff muscles, and strengthening the rotator cuff muscles in addition to the scapular stabilizers, the shoulder blade muscles. Then, of course, it's important to make sure that you don't return to the same activities which could again aggravate the rotator cuff problem.
It's important that in the treatment of rotator cuff or impingement type syndromes that we follow some of the advice that we just heard. Physical therapy is one of our hallmarks of treatment, where we try to strengthen the muscles around the shoulder to keep that pinching down. A lot of times what we do is we concentrate on the muscles that turn your arm in and out, so that as the muscle tone here increases, then as you bring your arm up, these muscles tend to pull the arm down so it doesn't pinch as much under the bony roof. So that's one of the strong points of the treatment. Of course, when people start to have night pain to the point that it's that disabling, then a lot of times what we'll do is we'll try a steroid injection up in that bursa area, and that will cut down on the inflammation a lot quicker. But we're going to go away on break, and we can talk more about it later on. Thanks for joining us.